Welcome to week 3 of abnormal psychology. This week we will practice applying treatment approaches to specific presenting symptoms. So, as you have already engaged, you will have various vignettes presented for you before you. Sometimes we call those scenarios. And in looking at those scenarios, you will decide, based upon criteria, of course, which treatment approaches. Now, we're speaking of uh, is it a biological approach that's necessary, a behavior approach, cognitive, humanistic existential, or a social cultural approach that, and not to forget psychodynamic, that best addresses the presenting symptoms. So obviously, if you have a client whose self-talk is negative, whose self-talk keeps them in a depressed state, for instance, say if they really believe that there's no hope for themselves, they have no hope for the future, or they have no believe in positive change, and in their mind, in their self-talk, their mental tape recorder, they continue to focus on that. That is their primary way of thinking. Obviously, we're talking cognitive and thinking, and so the better treatment approach would be a cognitive approach, as opposed to, it may not be physiological. It may have nothing to do with their neurology, nor may it have anything to do with brain structure. It also may have absolutely nothing to do with the chemical imbalance, but simply a way that a person processes their mental states. And we can do that process of elimination for each one of uh, theoretical treatment approaches to mental illness. So again, welcome to this week's YouTube video, and this is actually just a practice video to be used in an online training course. Real videos will come at a later date.